Welcome to Health Nugget Media Channel, where we provide health-related nuggets and answer critical health questions to give valuable guides. Please subscribe to this channel. Today, we're delving into a pressing issue that affects millions worldwide: stomach ulcers. You may have tried various treatments, but the ulcer just won't go away. Well, in this video, we'll unveil the surprising real reason behind it, based on scientific evidence from reputable medical journal papers. Let's dive into the fascinating world of stomach ulcers. 1. Understanding stomach ulcers. To begin, let's grasp a basic understanding of stomach ulcers. Stomach ulcers, also known as gastric ulcers, are painful sores that form on the lining of the stomach, or the upper part of the small intestine, known as the duodenum. They are primarily caused by the bacteria Helicobacter pylori H. pylori, and overuse of nonsteroidal anti-inflammatory drugs, NSAIDs. According to a groundbreaking study published in the New England Journal of Medicine by Warren Jr. and Marshall B.J. in 1983, they were the first to demonstrate the presence of H. pylori in patients with chronic gastritis and peptic ulcers. This discovery revolutionized our understanding of ulcer formation and its treatment. 2. Persistent stomach ulcers. While most stomach ulcers heal with appropriate treatment, some persist despite all efforts. This phenomenon is referred to as refractory ulcers. A study by Malfort-Heine P. et al., published in Digestion in 2008, found that approximately 10 to 20% of patients with stomach ulcers do not respond to standard treatments, making it crucial to investigate the underlying reasons for this resistance. 3. The role of H. pylori. H. pylori is a resilient bacterium that can adapt and evade conventional treatments, leading to treatment failure in some cases. A research paper by Sauerbrachet al. published in the European Journal of Gastroenterology and Hepatology in 1993, highlighted that the ability of H. pylori to produce urease and colonize the gastric mucosa makes it highly resistant to acidic conditions, allowing it to persist in the stomach. 4. Biofilm formation. One of the lesser-known factors contributing to persistent ulcers is the formation of bacterial biofilms. A study published in the Journal of Gastroenterology and Hepatology by Yonizawa H. et al. in 2009 demonstrated that H. pylori can create a protective biofilm, shielding itself from the immune system and antibiotics, further complicating the treatment process. 5. NSAID-induced ulcers. Apart from H. pylori, the chronic use of NSAIDs, such as aspirin and ibuprofen, can also lead to stomach ulcers. According to a comprehensive review published in the Journal of Clinical Gastroenterology by Singh G. and Triadafilopoulos G. in 1999, NSAIDs hinder the production of stomach mucus, which normally protects the stomach lining from acid damage, thus increasing the risk of ulceration. 6. Stress and lifestyle. Stress and lifestyle factors can exacerbate ulcer symptoms and hinder the healing process. A study conducted by Cohen et al., published in Psychosomatic Medicine in 1999, revealed that stress can delay the healing of gastric ulcers by impacting the body's immune response and increasing inflammation. Understanding the reasons behind persistent stomach ulcers can help guide better treatment strategies. If you find yourself dealing with an ulcer that won't heal, consult a gastroenterologist to explore the best options for your specific case. Remember, early diagnosis and prompt treatment of H. pylori infections and NSAID-related ulcers are essential for a faster recovery. Always follow your healthcare professional's advice, and never hesitate to seek medical attention if you experience persistent symptoms. Thank you for watching this video. Try to comment below and share this video. Please, don't forget to like and subscribe to this channel.